The curtains have been drawn on Mulago Hospital Executive Director Dr. Ddumba bringing to an end a tumultuous 4-year spell as the head of the National Referral Hospital. He will be replaced by Dr. Byarugaba Baterana, who has been the acting Deputy Executive Director. The hospital publicist Dan Kimosho says Ddumba has been redeployed to the Health Ministry, where he will oversee an African Development Bank project to build hospitals.
I have not heard, absolutely not, any news like that he has been fired. You see, firing would mean that he would completely leave the Ministry of Health.
However, the Permanent Secretary, Dr. Mulago, in an interview, says action was taken because of poor management.
Unfortunately, he became a victim of some people who are gamblers, and the institution couldn't run, and so we couldn't sit around and watch people complaining every time.
Several other officials at the hospital have also been arrested as a result of drug theft and mismanagement of funds. Not only have the winds of change gutted Mulago Hospital, but the entire regional referral hospitals. Many directors early this year have been replaced with a new breed of leaders supposed to herald change in the fledgling health sector. The changes come on the heels of President Museveni's pledge to rid the health ministry of thieves and incompetent managers. Though his transfer was heavily couched in diplomatic language, it's apparent the last days of Ddumba's reign as director before the axe fell on his head at the National Referral Hospital were agonizing. A litany of negative news stories, including a damning story where patients protested against neglect and allegations of a power outage that led to deaths of patients at the hospital, were perhaps the last straw that broke the camel's back. As patients trot away and doctors flee for better wages abroad, the tragic story of Mulago, run under adverse circumstances, flooded with an overload of patients, also bears heavily on the career of a man who spent a span of over 30 years at the hospital.
So I think we need someone, however good he is, but who can perpetuate like teamwork, encourage hard work, encourage compliance to our treatment protocols.
A myriad of problems perhaps could explain his exit. Some sources at the hospital say Ddumba, a physician and scholar, was either offered a poison chalice or he fell on his own sword as an inept administrator. Emam Taizibwa, NTV 11.